morning, healthy people. Are you or your parents needing to sign up for a Medicare Part D plan? Are you needing a new plan? Or are you needing to change an old plan? Are you confused as to which one is the best? Stick with me, and by the end of this video, you will know exactly how to navigate the Medicare.gov website and choose the plan that best suits your needs. If you find this information helpful, please subscribe and don't forget to click that little bell so that you never miss out on important information that helps you navigate the healthcare system. Over the years, I have helped guide many Medicare-eligible patients through the sometimes confusing Medicare.gov website in order to help them select the best Medicare Part D plan that suits their needs. Today we'll go through that process so that you feel confident in choosing the plan that is best suited to you, your medications, and the pharmacy that you're used to using. So let's begin. First we go to Medicare.gov and we click on the Find 2020 Health and Drug Plans. The next screen takes you to where you can either log in if you've used the system in the past, create a new account if this is your first time using, or you can continue without logging in just to look around. What type of 2020 coverage are you looking for today? There are various types of Medicare programs that help pay for some of your medications. Medicare Advantage plans roll A, B, and D into one plan and cover most aspects of healthcare costs. Medicare D is what we are looking for today. Next, it asks you for your zip code so that Medicare can find all the plans that are available in your area. For example, we are going to put in the zip code for Smith Center, Kansas, because that is smack dab in the middle of the United States. And hit continue. Do you get help with your costs from one of these programs? In our example, we are going to say that I don't get any help from any of these programs. And hit next. Do you want to see your drug costs when you compare plans? Well, yes, we do. How do you normally fill your prescriptions? In this example, we are going to tell Medicare that we get our prescriptions at a retail pharmacy. If you normally get your medications at a mail order pharmacy, check that box. And if you get your medications some at a retail pharmacy and some in a mail order pharmacy, check both. Then hit next. Add your prescription drugs. So we're going to begin adding medications. And in this example, I take Eliquis, which populates in the drop-down list. I select that. I hit Add Drug. And the 5 milligram tablet pops up first. That is not the strength I take, so we hit this little up-down button on the right. And I take 2.5 milligram tablets. I take them twice a day, so I need 60 tablets every month. And I hit Add to my drug list. If that were the only medication that I take, I would hit Done adding drugs, but it's not the only one I take. So I hit Add another drug. I also take Lantus. Select that one. Hit Add Drug. Yes, I use the 100 unit ml solution pen injector, but I don't get 5 a month. I only need 3 a month. So I drop down list, I choose the 3 ml pen, and I tell Medicare that I use 3 pens every month. And I hit Add to my drug list. So now my drug list says that I take Eliquis 2.5 milligrams and Lantus. But I also take lisinopril, just the plain one, add drug. Again, the 20 milligram tablet is not the one I take. I take the 30 milligram tablet. I take 1 a day or 30 tablets every month, and I add to my drug list.
So going over my drug list, I take Eliquis 2.5 milligram tablets. I get 60 of them every month. I use the Lantus pen injectors. I get 3 ml pens and I use 3 of them every month. I take lisinopril 30 milligram tablets. I take 30 of those every month, and that's all I take. So I am done adding drugs. Next, Medicare wants to know where I get my medications filled. And I usually go to the Midwest Family Health. So I click that. You will see that there are many other pharmacies listed on this page, the next page, the next page. But that's where I usually get my medications, is at Midwest Family Health, and so that's the only one I'm going to put in. This page brings me to the plans that are available. According to this, there are 28 prescription drug plans available in my area. I want to go over here where it says sort plans by. The lowest monthly premium doesn't really interest me because I need to know how much I'm going to pay for my medications too. So I hit the drop down button and I'm going to tell Medicare that I want to know what the lowest drug cost is plus the premium cost, so I know what my total out of pocket is going to be each year. So this brings up many plans in order of lowest cost to highest cost. And since most of the time you're going to be interested only in the lowest cost plan, and that's overall your medications and the premium, we're going to look at this first one. So this first one, my plan is going to cost me $18 a month. So that's the next plan is $30 a month. So that's pretty good. That's $12 a month cheaper than the next plan. It tells me I have a $435 drug deductible, and every plan has a deductible. Now, some of them will roll the drug deductible into the premium cost so that you don't get a shock at the cash register in January. But most of them just make you pay the deductible first, and then your benefit kicks in after that deductible is met. So every January, you're going to have to meet $435 deductible before your drug benefits kick in, no matter what Medicare Part D plan you choose. The next section tells you your estimated drug cost plus your premium cost for the entire year is going to be $1,401.18. That includes your deductible, your premium, and your co-pays for the year. So next, let's go and look at the plan details. Again, it tells you that it's $18 a month. You have a $435 a year deductible. This explains your tiers. If medications change, if something gets added, you might need to know this information. If it's a preferred generic, it's going to cost you $5 a month. If it's just a generic but not on the preferred list, it's going to be a $10 copay. If it's a preferred brand, it's going to be a $47 copay. If it's a non-preferred medication, you're going to pay 50% of the retail price. And if it's on the specialty medication list, you're going to pay 25% of the retail price. Gap coverage. The gap, or sometimes called the donut hole, is when you have reached your maximum limit of drug benefit and then you go into what is considered the gap. This does have some gap coverage, this policy. In this policy, your generic medications will cost you 25% of retail, and your brand names will cost 25% of retail. Generic medications are usually fairly inexpensive, so if a medication costs $10 and I have to pay 25%, that's $2.50. That's not bad. If a medication is a brand name and costs $500, then I have to pay $125 a month, and that gets a little pricey. If I come out of the gap phase and enter the catastrophic phase, my medications will cost generic drugs $3.60 or 5% of the retail cost, whichever is greater. And the brand drugs is $8.95 copay or 5%, whichever is greater. Midwest Family Health Pharmacy is a preferred in-network pharmacy, which is where you want it to be because you will get the least copays and the best prices in a preferred in-network pharmacy. My Eliquis is going to be $458.24 that first month until I meet the $435 yearly deductible, which I will meet that first month. My Lantus is going to be 40 cents, and my lisinopril has a zero copay. So that first month, I'm going to be paying $458.64. After that, Eliquis drops to $43 a month, the Lantus stays at 40 cents, and the lisinopril stays at zero copay. So the second month is $43.40. My copays stay at $43.40 until I hit the cost and coverage gap. At that point, Eliquis goes to $114.56, the Lantus stays at 40 cents, and the lisinopril goes to 70 cents for a total of $115.66 a month. If I come out of the gap and enter the catastrophic phase, my Eliquis will drop to $22.91, the Lantus stays at 40 cents, and the lisinopril goes up to $2.81 for a total of $26.12. Here's where they've worked out the estimated total drug and premium cost. My $435 deductible was met in January. I will enter the coverage gap in September, but I will never come out of the coverage gap and enter the catastrophic phase. They also give you a breakdown. January's medication cost is $458.64. February through August is $43.40. September is $75.76. And October, November, and December will be $115.66. This applies only if you have no medication changes and no additions. This section tells you which tier each of your medication is in. This reiterates my medication list, the quantity I take each month, and whether it's a brand or a generic medication. This tells me that Part B drugs are not covered. And down here, this tells me what the star ratings of the plan is. Star ratings are based on different categories. So overall, this plan gets a 3.5 star. They get drug plan customer service 4 stars. Member complaints and changes in the drug plan's performance is 4 stars, which is very good. Member experience of the drug plan is 4 stars. Drug safety and accuracy of drug pricing is 3 stars, which is average. This final section gives you the contact information, the website, the physical address. If you've already had this plan, this member's phone number would be the one you call if you have questions. If you haven't signed up and you have questions before you want to sign up, here's the phone number to call for questions before you sign up. While this plan may cost you the least amount of money over the year, you may want to look at least some of the other plans to see if there is another plan that would meet your needs better, even if it costs more in the long run. If it does seem like this is the plan you want to enroll in, you scroll back up to the top of the page, and in the right-hand corner here, there's an Enroll button. This pop-up window tells you everything you're going to need to begin the enrollment process. And you're going to need your Medicare number and the effective dates. Recently, new Medicare cards were sent out with new Medicare numbers. It is no longer your Social Security number, so you need to make sure that you have your new card with your new number available. If you have any other insurance that covers health, you need to have that card available so that you'll have your policy numbers and your group numbers off of it. If you know of any changes that are likely to take place in the next year, such as moving into a nursing home or residential care facility, if possible, if you have those dates available, they're going to need that information too. Next, you hit Start and walk through each question that will be particular to you. Make sure after you've read this and understand it well, you check that I've read and understand the contents of this page, and then hit Next. What problems have you had with Medicare Part D in the past? Is this your first year on the program, or are you a repeat customer? Comment below if you are happy or frustrated with Medicare Part D and why.
Are you just now entering the phase of your life where you have to help an elderly parent plan for the future? I've put together a guide that will help you work together and discuss these sometimes difficult subjects. You'll find a link below in the description where you can download this guide. I hope it helps. Don't forget to like this video, share it with your friends, and subscribe to my channel. There will be a new video every Monday that will help you navigate our sometimes confusing healthcare system. Thank you for joining me today. God bless.